to Wellness Wednesday in our 2021 Red Week. I am Jacqueline Tyson, President of the Rochester Alumnae Chapter of Delta Sigma Theta Sorority Incorporated. We have been in this pandemic for about a year and a half, so our topic tonight is a very important one: COVID-19 and the Black community. Before we get started, I'd like to share a little history about our organization. Delta Sigma Theta Sorority Incorporated, founded 108 years ago at Howard University, is an organization of college-educated women committed to public service with a primary focus on the Black community. The Rochester Alumnae Chapter, chartered in 1965, serves Greater Rochester with programs that reflect a 5-point programmatic thrust, including economic development, educational development, international awareness and involvement, physical and mental health, and political awareness and involvement. I would like to introduce Jennifer Boutte, Chair of our Program Planning and Development Committee, who will be the moderator for our panel this evening. Thank you.
Good evening, everyone. And again, thank you all for joining us tonight. Tonight, we are celebrating our 2021 Red Week. As President Tyson said, Wellness Wednesday is a very important topic across the community, especially as it relates to the COVID-19 pandemic. That being said, we are going to start off by introducing our most amazing panelists this evening. Tonight, we have with us Dr. Yvette Conyers, Dr. Linda Clark, and Dr. Melanie Silas. Welcome, ladies.
Thank you.
So if we could start off quickly by having our panelists just introduce themselves, and then we'll get right into our conversation, starting with Dr. Conyers.
Good evening, everyone. Happy Wednesday. My name is Dr. Yvette Conyers. I am a doctorally prepared nurse practitioner, family nurse practitioner, and been a nurse practitioner for almost 10 years. But I primarily teach at St. John Fisher College in the Wegman School of Nursing to undergrad and graduate students with a passion and focus on social determinants, healthcare disparities, and public health nursing. I'm also the president of the Rochester Black Nurse Association, a chapter of the National Black Nurse Association. I'm happy to be here with you all tonight.
Thank you, Dr. Conyers. Next, we'll have Dr. Linda Clark.
Good evening. My name is Linda Clark. As Jennifer Boutte mentioned, I am the Chief Medical Officer for Common Ground Health, which is a health planning agency. My focus and work there is all about equity. So that includes our health coalitions, working on the pipeline to health careers and more. I still have a small private practice in preventive medicine and occupational medicine, and I serve as the president of the Black Physicians Network. Thank you for having me.
Thank you, Dr. Clark. And last but not least, we will now have Dr. Melanie Silas.
Hello, everyone. Hello, hello, hello. My name is Dr. Melanie Silas. I am a professor at Monroe Community College, where I've been there for 19 years. I primarily teach courses in the counseling and health areas, death and dying, grief and loss. I recently created a course called Black Women's Mental Health and Wellness that I teach between those two primarily. I've taught courses such as emotional wellness and stress management. Over the course of my career, I've really focused on Black women and girls empowerment and overall health and wellness. It is wonderful to be here tonight with my colleagues, Dr. Clark and Dr. Conyers. And so I think that, people are going to be in for a wonderful panel tonight.
Thank you so much, Dr. Silas. So we are going to get right into the conversation. The COVID-19 pandemic. The COVID-19 pandemic has brought social and racial injustice and inequity to the forefront of public health. It has highlighted that health equity is still not a reality, as COVID-19 has unequally affected many racial and ethnic minority groups, putting more at risk of getting sick and dying from COVID-19. The term racial and ethnic minority groups includes people of color with a wide variety of backgrounds and experiences. Negative experiences are common to many people within these groups, and some social determinants of health have historically prevented them from having fair opportunities for economic, physical, and emotional health. Social determinants of health are the conditions and the places where people live, learn, work, play, and worship that affect a wide range of health risks and outcomes. Panelists, tell me briefly, in your profession, how have you seen or how have you viewed the COVID-19 pandemic, as it relates to your professions? We can start out with Dr. Conyers.
Yes, and so just in healthcare in general, but specific to nurses, it has caused an additional burden and stress like many. Nurses have been at the front line at the pandemic. Year 2020 was the year of the nurse and the midwife. And we have really seen through and through how much this pandemic has affected the profession, to the point where we have nurses leaving the profession because of how tired they are, and how much of a burden it has been for them, having to go in every single day to battle up, I'll say that, to put on gear, to deal with this virus, losing their colleagues on the front line while working in the hospital, as well as being able to protect themselves when they're going home from the sharing the virus from their family, who are they living with. I think we definitely seen an impact in those who we were relying on to come into the nursing profession. We've had some nursing students who decided not to come back for future semesters to be nurses because they didn't really want to deal with the pandemic. I'm actually okay with them choosing now versus getting involved and then pulling back. But I think from a nursing perspective, we have definitely seen it impacting our current nurses. And then also when we talk about preparing the next generation of the workforce, also impacting the workforce.
Thank you so much. Wow, that's powerful. Dr. Clark?
What she said, Dr. Conyers and I, we run together. But, on the flip side, because I think, a lot of that is definitely important as we're looking at mandates and people leaving the medical field and having to be creative about allowing other people with skills to step in and do some of the work that they are prepared to do. But I think one of the biggest issues that affected me as somebody who's working in equity is how this COVID virus has affected us all differently, right? A Black person is twice as likely to die as a white person from COVID. If you remember back in the beginning, all sorts of myths were running around like Black people can't get COVID. And then it turns out we were getting it at way higher rates than white people because of, like Dr. Conyers mentioned, those social determinants of health, where you had to work, where you had to live, how you got around, could you go to Instacart and, so all of those things. But on the flip side, we saw a lot of Black and Brown researchers and volunteers jumping in to create this vaccine, this preventive, I'm not gonna say it's a cure, but a good way to prevent death from COVID. So on that side, I felt very encouraged. We have a lot of people working together for a good positive outcome, but definitely a lot of disparities that we need to address. Thank you.
Thank you so much. And Dr. Silas?
Well, in terms of my professional space, dealing with students of all ages, of all races, of all backgrounds, we had that huge transition, a very quick transition, actually, in March of 2020 from going to face-to-face, delivering, modalities of instruction to literally going to remote, doing Zoom classes. And so that meant for us as faculty and staff, literally transforming the ways in which we delivered education. We flipped it over completely within like a weekend to a week. And so just to do that in your own space with your own classes, depending on how many classes you had to do that with. And then because I'm an adjunct coordinator, so I hire adjuncts to teach my courses, ensuring that they also could do that transition and do that well. So from one perspective, you have this complete upside down, turnaround of your work life space, right? We were doing things all in one space. And then you have multiple people. Some of us had multiple people in households doing everything in one space and trying to figure out how to do that. So when we think about how that impacted our students or even the community at large, you're talking about people, number one, losing or having all of these losses and having many grief responses that they could not even recognize as grief responses. So losing your ability to be socially mobile, losing the ability to connect with people directly. Some people lost their jobs over the course of COVID, and even ongoing, people are losing family members. I'm sure that all of us knows of someone personally that has passed away, whether either within our immediate families or extended family and friend networks who have passed away from COVID, and all of the things that go along with that. So the stress that COVID has caused, I'll share a couple of statistics. Pre-COVID, statistics around, mental health, maybe 1 in 5 Americans would experience some kind of mental health, disorder, illness, or some kind of experience. When we hit COVID, by the end of June of 2021, at least 40.9% of the population had experienced some type of mental health issue, And so when we talk about, stress and trauma, we were dealing with not only the traumas that may have been going on in people's homes, right? So sometimes, when we talk about children being home, sometimes those spaces being unsafe, we know that domestic violence rose significantly over that time. And we understand that, having access pre-COVID to counseling services and other support systems was extremely low, especially for Black and Brown populations. And so that access was, even more devastated. And I think that COVID also really highlighted the disparities within communities of access to technology, access to food resources, access to, support. So when we talk about mental health, we're not just talking about, this one thing, happened and this, caused this mental disconnection or mental anxiety, but you have all of your spheres of interactions going on. So your social, your emotional, your mental, your physical, your spiritual, all of those things work together to make a whole person. So when things are altered in your physical world, in your environment, it's going to impact your mental health. When you are grieving and you don't even realize you're grieving, or you're experiencing significant loss, and you don't know how to process that loss, then that is going to impact your overall emotional and mental health. Sometimes we respond or react to things that are going on because we don't have that anchor, either spiritually or emotionally or mentally, so that we can recover. Now, while all of this is going on, people feeling mentally foggy, people feeling anxious, people feeling overworked and overwhelmed. I know I did. I felt like we was meeting more. People felt like as soon as, just because we were working on Zoom, that you had more access to me. You have meetings that go back to back to back to back because now there's no more travel time in between. And then while you're having all of these Zoom meetings back to back to back, you're still in the presence of your own home, and you got kids going to school at the same time, and there's no longer no disconnect. There's no longer a separation between work and home and health and self-care. And so I think that for that first, I think that some people still have a problem with having a sense of balance, because COVID really did alter our way of life. I'm sorry, I don't mean to take.
You're fine.
You're fine. That is such a loaded question, because it impacts our health. So Dr. Clark and Dr. Conyers, is talking about how, the things that they're dealing with there. Well, we have a whole community, that is dealing with that plus, right? And, I have to say that problems didn't just start when COVID started. People were already struggling before COVID. And so when COVID came, the struggle became more apparent.
Thank you so much, Dr. Silas. So more on the impact of COVID-19 in the Black community. Many factors such as poverty and healthcare access are intertwined and have a significant influence on the people's health and quality of life. Racial and ethnic minority populations are disproportionately represented among essential workers and industries, which may be contributing to COVID-19 racial and ethnic health disparities. Some of the many inequities and the social determinants of health that put racial and ethnic minority groups at increased risk of getting sick and dying from COVID-19 include discrimination. Unfortunately, discrimination exists in systems meant to protect well-being or health. Examples of such systems include healthcare, housing, education, criminal justice, and finance. Discrimination, which includes racism, can lead to chronic and toxic stress and shapes social and economic factors that put some people from racial and ethnic minority groups at increased risk for COVID-19. Dr. Clark, as you specifically work in that equity space, for people who also work in that space that are listening in on tonight, given your experience since the COVID-19 pandemic began, what advice could you give to them if you had to just think of a couple of things that you would be able to share as it relates to working in the equity space as the COVID-19 pandemic continues?
I think one thing that we have to understand is that what you do as an individual changes you as an individual. It's policy that's going to improve entire populations. So I think, I don't want to, I think a lot of times we, including in preventive medicine, play the blame game, right? Well, if you didn't smoke, you wouldn't have blah, blah, blah. And if your diet was, you wouldn't have blah, blah, blah. But we are blinded to what happens upstream that drives those behaviors. So, if you want me to give individual advice, I would say, try to understand and recognize what can protect you, what can be harmful. But understand the caveat, who delivers the message is very important, because we don't trust. I admit there are times I don't trust. I've had my own issues, with the health system. So if I'm going to distill it down, I'm going to say, one, try to get your information from a reputable source. Please call Dr. Conyers. Even though we like Aunt TT, she didn't always know everything about what's going on. Protect yourself, but be respectful and protect others. So you can certainly make your decisions, just like we were talking about our colleagues who have chosen to remove themselves from the workforce. And that is your choice, but we're still needing to protect others, especially who can't get protected yet, like the younger kids who can't get vaccinated. And then, stay educated about other things related to COVID. We often have resources that we don't know about because we don't, and Dr. Silas has already talked about that, right? We have this digital divide. Not everybody has equal access to information, but whenever you can, avail yourself of information. So I guess those are my words of advice to the individual, but I got to tell you, we got a societal issue and it just needs to be handled at that level. So.
Thank you so much.
Mm-hmm.
Dr. Conyers or Dr. Silas, would you all like to follow up on that?
I don't think there's much to follow up. I will just say, although we have issues at the societal level, people's voices and people can have seats at those tables. And it's important that whatever you're advocating for, whatever you're passionate about, that even people as a community member, you don't have to have this big title. You don't have to be a physician. You don't have to be a nurse. You can be a community member, and you pull yourself a seat up to that table to impact those whose voices won't be able to be heard. So then you are then impacting that. I think sometimes people think that, oh, I don't want to be involved in policy. I don't want to be too political. These are how things change. And like Dr. Clark said, it's not only necessarily at the individual level, but it's at those who are making policy decisions, which is why it's important to vote, which is why it's important to every November, you know what I mean? We vote, not just in the big 4-year election, but also locally. And so, yes, we have societal issues. Those societal issues can be changed with people coming together to use their voice and pull up a seat at the table.
Thank you so much. Dr. Silas?
I can't really add too much more to what my sisters in the fight have said. I will just add this one thing, that, you know, we all at some point in time within the positions that we have, identifying what our positionality is, whether that's at MCC, whether that's within our churches, whether that's with our community spaces or organizations, we all have a voice. And number one, we have to be advocates for ourselves. So whether that is being an advocate in the doctor's office when you're in there, you know, one-on-one with your doctor, whether that's being an advocate in the workplace when you feel like there are microaggressions or, you know, discriminatory, you know, acts being, you know, forced upon you, whether it is being an advocate for yourself within relationships, within friendships, and, you know, because that's a part of the social sphere, right? It's a part of the things that, it's a part of the overall system. You know, we first have to be advocates for ourselves in our own spaces and create boundaries where we feel like people have overstepped their right into our space, whatever that might look like, right? And then we have to declare that, you know, when we are advocates for ourselves, we have to, you know, not just create our space, but make sure that people stay within their spaces. But I just feel very strongly about being the voice that you are called to be in the spaces that you are placed in. You are placed in the space, in the workspace, in the environment that you're in, because in that season, the season that you're in, your voice is needed, your perspective is needed, your creativity is needed, your lens, you know, is needed, how you see things, you know, how you process things. And so when we shrink behind other people, or when we say, oh, that person will say something, or, you know, somebody else will deal with it, then we really yield our power, right? And we yield our purpose in that moment by not being the advocate that we're supposed to be for whatever, you know, the case might be. There was a time when I had to be an advocate for a colleague. It wasn't comfortable, you know, being an advocate in changing systems is not always, it's not always comfortable, you know, and if you have lived a life of pure comfort, then you're not doing your job. You know, as a leader, as a community member. But I think that advocacy first starts with yourself. And I think that once you become comfortable with advocating for yourself, then, you know, you will certainly start to become more comfortable advocating for others and changing systems. But, you know, if we wait for other people to do it, then change will never happen.
Thank you so much. So for everyone listening, I hope you heard all of that which was just shared. Advocacy for self is a must. So we're going to continue on with the conversation of healthcare as it is an inequity, especially during this COVID-19 pandemic. Healthcare access and its use. People from some racial and ethnic minority groups face multiple barriers to accessing healthcare. Issues such as lack of insurance, transportation, childcare, or the ability to take time off of work can make it hard to go to the doctor. Cultural differences between patients and providers, as well as language barriers, affect patient-provider interactions and healthcare quality. Inequities in treatment and historical events like the Tuskegee study of untreated syphilis in the African-American male and sterilization without people's permission might also explain why some people from racial and ethnic minority groups do not trust healthcare systems and the government. Dr. Conyers, Dr. Clark, especially you two who work in that medical space, I'm sure you guys have run across a number of things or even heard a number of things on social platforms as it relates to why there's the stigma that we don't go to the doctor, or especially during COVID-19, why we steer clear of going to the doctor. I mean, I know personally, I've heard of situations where people during the pandemic have gone to the doctor, and while they were in had one health condition, when they went in, some people actually contracted COVID, being in the hospital spaces and so on and so forth. So how do you recommend, I mean, I know you all have shared this tonight already, but what would be your advice, or what would you recommend that we as a people do, or what would the approach be that you recommend when it comes to how we access healthcare? I mean, Dr. Silas, she talked about advocating for herself, and it's so important as it relates to Black health. So what would you recommend? And I asked that question, it may seem very broad because I know you share, advocating for self or reading, not always listening to TT, reaching out to people in this professional space. So, what else would you recommend that we do as a people to kind of move away from how we've always thought about healthcare or accessing healthcare?
I'll start and let Dr. Conyers clean up.
Thank you.
Yeah, it's because her mind is younger. I gotta say this, but I think one thing we have to do is to become health literate, right? We need to make sure that we understand the information that's being sent, emailed, told, whatever. And that is complicated. It's not like you just wake up health literate, and it has nothing to do necessarily with you being literate, although it does help to be able to read well, but it involves other things like, knowledge of math, knowledge of, the medical system. And so I think, finding access to sources to become more, to understand better about healthcare and the systems is really important, but it's not always easy to do. And I think those of us who are experienced need to do our part in helping, and we also need to do our part in terms of being able to teach at a level people can receive. I think the other thing is to make sure that if you need support, get it and not be embarrassed about it. If you're going to have a serious conversation, it's sometimes, I don't care how smart you are, how health literate you are, you may need somebody there to be a second, pair of ears and to be emotional support for you as you're going through this. And I would like to say, in terms of the trust issue that you brought up around the health system, I think a lot of people say, Tuskegee. I think most people don't even really know fully what the Tuskegee thing is about. But what it is a symbol of the way we have been treated. And I would argue it's the way we were treated last week that is probably more important than what happened in the Tuskegee or lack of treatment trials. So I think that we need to recognize that mistrust is understandable. It's not, I don't think people are overly suspicious or paranoid, to use a clinical term, probably inappropriately. Excuse me, Dr. Silas. But it is understandable. And one thing that can help, and I'm going to keep talking about the pipeline because I think it's ever so important that we have people that look like us in all positions that we need throughout the healthcare system, but and that can be generalized too in education and other places too. And now I'll be quiet and let Dr. Conyers clean me up.
Not clean you up, but I agree. I'm going to also add, in framing that question, it makes it seem like we are the only ones responsible for going out and seeking healthcare. And I'm going to say, as we are creating this pipeline of next generation of professionals and the ones who are even doing the mentoring and the role model now, what are they doing to ensure that people have access? What are they doing to ensure that they are not putting their bias, that they are being aware of their discrimination? How are they addressing their racism? How are they addressing institutional or structural racism in the places that they work, right? So yes, as patients, as a society, as us as people, right, it's important that we have the tools, the advocacy, the knowledge to go out and do these things. But what are healthcare providers? How are they meeting us? Are they coming to the community where we are and meeting us where we are? Are they, making it easy for us to access their building? Are they open later at night or early in the morning or on weekends so that we can get there? And so it's a collaborative thing. It should be a joint effort. It shouldn't just be me seeking out the doctors, but what are they doing on their end to make sure that they are providing me with the care I need based on my cultural preferences?
Amen.
Thank you so much.
You're welcome.
Dr. Silas?
I know that the medical side is not my side, but the mental health side is my side. And that is also considered healthcare access. And I just want to say that I am on the board as well as Dr. Conyers is on the board for the Interdenominational Health Ministries Coalition. And as one of my focal points as a board member was to create this program called Community Counseling Circles. And just like Dr. Conyers is talking about bringing services to the community, what that program did, and this was really based off of a lot of my data from my dissertation around barriers of access for mental health care, especially for populations of color. We partnered with churches, I think at least 6 of them, and we partnered with social workers and counselors of color to actually provide services, up to 6 sessions of counseling to the community, to Black and Brown, faces. And so, what we did was we didn't just rely on the system that currently existed. We created a system that worked for us. So while we do have professional responsibilities, we also have a communal responsibility to one another. Sometimes we can't do the work that we want to do within the 4 walls that we might, work in. Sometimes it requires for us to create a different system within our community that speaks to the needs, the values of the people and the community that need the access. So in that particular sense, what we did is we provided access. We established trusted relationships. So you have pastors who are, pillars and gatekeepers within their congregations, and people listen to their pastors and their ministers. And so we got them on board, and they understood, who would be serving their congregants. And so you had this collaborative relationship between the counselors and the pastors, and an understanding that no harm would be done, to their parishioners, and that everything was done with the utmost sense of professionalism. We combated stigma just within that alone, to say that dealing with your mental health is not is not a bad thing. It's not a sin. That we need prayer, we need Jesus, and we need a counselor. And anytime you hear me speak, I'm gonna say that as an educator and a woman of faith, as a minister, I have my Jesus, but I also have my counselor, and she is Black. And and I have to make sure that I stop making friends with my counselors, because I keep losing them. Because it becomes a conflict of interest. So I told this one, I said, now look, we ain't gonna be friends. I like you, but we can't be friends. But bringing those resources to to the community in ways that have never been done before. I was just in a conversation, today, talking about diversity and equity and all this stuff. And it's like, and I said, well, maybe it's my age. Maybe it's just where I am in this season, but I'm so over talking about stuff. I'm really about doing stuff. And so, we can have conversations all day, but take those conversations and really make them action. So, while yes, it is my job as a counselor, as an educated counselor, as a professor, to do my job in making sure people have access to different things, but it's also my job as a community member. We have 1 million 501c3s here. What IHMC did was they got a grant and they made it happen, so of course you have to worry about how the funding will continue to come, but at least we made it happen. And for 30 people, 30 families to have access to 6 counseling sessions, which is more than what the average Black person completes on a regular, is huge. And if we could expand that, expand that to our children, expand that to other, areas that need it, that's really saying something. So I think that when we talk about what we recommend for access to care, healthcare, and mental health care, sometimes you got to you have to create what it is that you need. Sometimes we cannot always depend on the systems that currently exist. Those systems weren't always there. Someone had an idea and they created it. I'm all about creating whatever I want it to be. So we have to, as a community, create the spaces that we want to see.
Thank you so much. We have to create the spaces that we want to see. That's powerful. Moving on. So, Dr. Silas, you talk a lot about mental health. Anyone who knows you knows how passionate you get about that. So I just want to touch on mental health wellness for a moment, or the lack thereof during the COVID-19 pandemic. Psychological distress for many Black Americans often goes untreated, and this is another area of disproportionate impact compared to white individuals that existed before the pandemic. For instance, 69% of Black adults with mental illness and 42% of Black adults with serious mental illness received no treatment in 2018. Similarly, 88% of Black adults with substance use disorders reported receiving no treatment in 2018. Substance use has increased during the pandemic, and pre-existing trends such as increased drug-induced deaths among Native Americans, Blacks, Latinxes, and older adults have only gotten worse. Prior to the pandemic, individuals with mental illness faced many obstacles in obtaining adequate physical and mental health care. While stigma and minimization of symptoms are often identified as significant obstacles for mental health care, studies have shown that cost is cited as the biggest barrier. Thus, this impacts poor and historically oppressed communities the most. Pandemic-related public health measures at times left those most vulnerable without services or on the margins. So during this Red Week, we were supposed to have our Mental Health Matters Monday, and we had to postpone it, unfortunately, due to all the outages on the social media platforms. And while today is Wellness Wednesday, I want to dive into mental health a little bit because I feel like the conversations have been, of course, more illuminated since COVID-19. I know growing up, you would hear about mental illness, mental health, and why it's important and all the stigmas attached to it, but no one really took the time to explain it. And one of the things I have recognized as I've gotten older is that mental health illness, it has no face, it has no race. You just don't know when you're sitting next to it. You don't know when you're talking to it. So let's take some time to really dive into mental health as it relates to COVID-19.
I'm gonna read a quote for you. Audre Lorde said that caring for myself is not self-indulgence. It is self-preservation, and that it is an act of political warfare. And I start with that quote because when we talk about mental health, we have been socialized as Black people not to care for ourselves and not to see ourselves as valuable. And any act of self-love or self-care, any act of respect, any act of kindness, any act of honoring is in itself a political act against the status quo of what society has taught us to be, okay? When we talk about how mental health impacts our overall health and wellness, I'll give you this statistic. People with depression have a 40% higher risk of developing cardiovascular and metabolic diseases than the general population. And people with serious mental illnesses are nearly twice as likely to develop conditions such as high blood pressure, stroke, and heart disease. And when we look at the population of people who suffer disproportionately more than any other population of blood pressure, stroke, heart disease, or any other cardiovascular diseases, who is that population? Black folks. And when you look, and if you want to go down, peel the onion of that layer of the Black community, when you get to the bottom of the barrel, the ones who are the most affected by that is Black women. And so when you talk about mental health, we are talking about the ability to think clearly, the ability to have a sense of peace and soundness. It is not exclusive or in a vacuum. It is very much connected to your emotional health. It is very much connected to your social health. It is very much connected to your physical health and your overall everything, right? And so when we talk about COVID, even pre-COVID, it's just talking about this idea that loving myself is a stance. Like, I'm combating all of the negative messages that have been given to me since I was born about the color of my skin. There's colorism, light skin versus black, darker skin, good hair versus kinky hair, and all of these things. What is beautiful, as a Black person versus being compared to other populations. We're not even dealing with the trauma that is literally passed down within our DNA. It is genetically passed down, the trauma of our ancestors and everything that they went through, and combined with our own chemical balance or imbalance. People don't even know what they're reacting to sometimes, because that stuff is just ingrained in them, right? So when we talk about, mental health, somebody has to think, I got to be the one out in the street talking to myself with, raggedy clothes on. No, you can look just like me with makeup on, with, a good little crochet do, doing the work every day and still be depressed, still have anxiety. I just talked about my reaction to my brother's loss this past March. And I've had many, many losses, and all of them were significant for me. But it was something about my brother dying unexpectedly that I just could not function. Now, if you saw me every day, I was working every day. I was helping my family put together the funeral. I was not really talking to any of my friends or, anything like that, because if I talked about it, I would break down. And I knew in that moment that I just needed to get through initially just the first week. But like a month, 2 months after that, I was still having bad dreams every night, not sleeping well. I was still waking up crying every morning. I felt foggy. I couldn't think straight. There were times that I didn't want to get out of bed. Now you're talking to me, the one who always has a smile on her face, always, is talking about mental health. I'm a counselor, right? And so because I've been trained to be reflective about where I am and to be aware and very present with myself, I had to say, you know what, I need some help with this. Like, this is a problem for me. Like, I am not doing well, and so And I say this especially for, you know, the strong people, the people that we think are strong or know as being strong, because that is what they have symbolized for us. Check on your strong friends, because sometimes even the strong friends need to just lay out and cry sometimes, you know? So if I, as an educator, as a counselor, you know, had trouble dealing with that, imagine all the people who do not have the tools that I have. Imagine all the people who don't have the support systems that I have. Imagine all the people who can't even name what I could name, right? You know that something is going on, but you don't even know how to articulate what it is that you feel. Sometimes we have emotions that we don't have words for, you know? So when we talk about COVID, people were dealing with multiple losses. You know, grief is real. Grief is real, loss is real. And I always teach my students that loss does not equate a physical death, not all the time. Loss can be losses of relationships, changes of seasons. You know, we know that many people had significant losses of job, loss of social interaction, loss of emotional stability, loss of support systems, loss of, you know, advisor, loss of ceremonial tributes and rites of passages. So me and my line sister just had our rites of passage, getting our, you know, being hooded, you know, after completing our doctorate degrees 2 years ago, you know, a year and a half, 2 years ago. And I remember talking to her, and she said, you know, how do you feel? And I said, yo, Sans, I feel different. Like I feel different. Even though I've had my PhD since December 2019, in that moment 2 weeks ago, I just felt like, wow, finally this chapter in my life is complete. And she was kind of like, you know, teetering. And she was like, oh, I don't know if I want to go. I said, let me tell you something. I said, rituals are important. If that didn't teach me anything, rituals are important. And you had high schoolers who didn't have graduations. You had so many people who couldn't go to proms. You had you know, we lost our way of living that so many times we take for granted, but those small things become, you know, milestones that we can never get back. So when we talk about, you know, mental health, everything that we do to do self-care is important. Everything that we do to take care of ourselves and to create boundaries and to advocate for ourselves and to tell ourselves and to show ourselves that we love ourselves and that we are valuable and we are valid and that we're not delusional, that our experiences are real. Anything that we do to do that is absolutely vital to our overall just sanity, honestly. So I would say that do self-care, and whatever that looks like. This is a picture that I actually painted for my birthday, which was a week or two after my brother passed. And this was a symbol of me just saying, God, I need all the healing that you got for me, and just literally like giving it up. And that in that moment and doing that painting session with my close friends and family members meant everything to me, because that was my way of taking care of me, honoring my birthday, number one, turning 45, which is a significant, you know, milestone again in the pandemic. I turned 44 in the pandemic, I turned 45 in the pandemic, right? And then also taking care of myself in my grief of my brother. And so anything that you do that restores you, anything that you do that gives you a sense of calm and peace, anything that you do that lifts you, anything that you do that gives you energy, anything that you do that strengthens you, do that thing. And, you know, sometimes you have to stop in the middle of the day and say, what is it that I need right now? And if your body tells you, if your mind tells you, if your spirit is telling you, do that thing, because your body will always let you know what you need in that moment.
Thank you so much. Dr. Conyers, you're not a stranger to self-care.
I'm not. And thank you, Dr. Silas, for taking the lead on that answer. I'm not, but I'm going to say, when it comes to us as ladies saying, I'm going to get my hair done or nails done, that's grooming. To me, that's not even self-care. That's something we should be doing anyway, so that we can look presentable. And so it doesn't always have to be something big too, because someone may not be able to go afford a facial like I did yesterday, or, you know, whatever it is. But it's like, can you journal? Can you read something? Can you turn off the TV? Can you meditate, yoga, pray? Even going out to eat with friends, you got to be mindful of that, because then you eat too much and then you may be, are you balancing that with working out? And so I think for me, it doesn't always have to be these big things to address mental health, but normalizing it even around the dinner table, right? With the young ones, if you're a mother or a father, or normalizing mental health just among families in general, so that kids can see, yeah, I go to the doctor every year. I go to the dentist twice a year. That should be part of mental health discussions too. Hey kids, what y'all do today? You want to color, you want to take a minute and just to sit in our silence, take the tablets away. What else can we be doing? And really starting to introduce mental health at an early age, and then letting them figure out things once they get older. And then I'm going to say, in terms of nursing students, one thing that I do as a professor is, every single time I start class with my students, I say, what y'all do for mental health this week, over the weekend? Normalizing it, because getting into a healthcare profession, going through that process, 2 years, 4 years, 6 years, is difficult. And they need to know, as I'm entering this profession, even when I become a healthcare professional, what am I going to do for mental health? And so I normalize it. The very first thing I'm saying is, what did y'all do this past weekend for mental health?
Thank you. Dr. Clark, would you like to chime in?
I can be really quick. One thing I do is treat people with substance use disorders. And I think it's very interesting. At the start of this pandemic, one thing y'all remember, everything was closed, but the liquor stores stayed open. And you could, just pop your trunk and have that delivered. So we continued to self-medicate and try to put this different kind of salve on that's not really getting to the root of what's going on. I always say that every person I've ever treated with a substance use disorder also had a mood disorder, right? Trying to change something in terms of how they felt. And one thing that people thought was a real plus, and I'm probably going to get hate mail about this, but people thought was a real plus, was now we have access to telehealth services. And I think that's awesome. But I felt something lost between me and my patients. And maybe because I'm a more relational provider, don't come here just asking me for a prescription. I want to have a discussion. I'm not your prescription pad. I'm not trying to fool you into saying it's a therapeutic relationship, right? Because I'm not a psychiatrist, I'm not a therapist, but I'm certainly going to understand, is it well with you, before we just start writing some prescriptions. And I found that with the telehealth, there was a certain distance that just didn't sit well with me. I thought it was great because we needed to make sure we kept some kind of contact. And that did vary, right? Depending, what you drinking? I'm like, I just talked about the liquor store deliveries. I'm like, oh, my sister's over here. That's not what we mean by self-care. I'm just kidding. But, I remember getting on the video call with one, and they were always terrible connections, because people's internet is not always good. Not everybody's got, great equipment. And I just remember my sister talking to her, and she's just smoking. I'm thinking, now she wouldn't do that if we were in the office together. And I told her, that is really disrespectful, talking to me like that. So I think, there were some pluses and some minuses, but we have a lot to do to figure out the best way to make sure that everybody has good access to mental health and treatment for substance use disorders. So once again, as you hear everybody say, a crisis is a terrible thing to waste. We need to get it right. This is an opportunity to get it right for more people. That's it.
Thank you all so much. Last but not least, we cannot talk about COVID-19 without talking about the vaccine. So let's talk. Hey, somebody got excited. So let's talk about COVID-19 vaccine equity. The CDC says it's committed to COVID-19 vaccine equity, which is when everyone has fair and just access to the COVID-19 vaccination. There are many social, geographical, political, economic, and environmental factors that create challenges to vaccination access and acceptance, and that often affect racial and ethnic minority groups. Some of those factors include education, income and wealth gaps, job access and working conditions, racism and other forms of discrimination, gaps in healthcare access, transportation and neighborhood conditions, and lack of trust as a result of past medical racism and experimentation. Because of these and other challenges, some Black or African American people and Hispanic or Latino people are less likely to be vaccinated against COVID-19 than people in other racial and ethnic minority groups and non-Hispanic white people. In addition to being less likely to get a vaccine, Black or African American people and Hispanic or Latino people are more likely to get seriously ill and die from COVID-19 due to the factors that I just named. So, if we can summarize this with all of your perspectives as it relates to your profession on the stigmas against the vaccination, but more importantly, encouraging Black people and other minority groups as to why the vaccine is so important, that will be a wonderful way to close out tonight's forum. Starting with you, Dr. Clark.
Thought you were gonna say finish with her, right? Look,
You want to finish? You can take
no,
it
no.
I think Dr. Silas agrees. Do we want to have Dr. Clark take it home?
No. I need my buddy, Dr. Conyers, right?
No,
because
Dr.
we
Conyers. That's 2 thumbs up, Dr. Clark. I don't know. We may have to hold on you for a moment. Dr. Conyers, do you want to start?
I sure will, and then we'll let the elder, the elder, Dr. Clark. No, wait, we'll let you finish off. I would say I trust in science. I believe in science as a nurse, as a healthcare profession, and so for me, the science shows us that those who receive the COVID vaccine are not going to die. You can die from COVID infection. We have seen, and Dr. Clark has already spoken to, the increased hospitalizations, especially among Black and brown folks, the increase us being on ventilator, and then death, disproportionate, right? All of that stems to back to a lot of the social determinants of health, us being frontliners, et cetera, et cetera, et cetera. I think with the vaccine, addressing hesitancy was real, is real, continuing to address any concerns that people may have, any valid concerns. We have to continue to do that. But this is when you have conversations with trusted healthcare professions. This is when you don't go to Auntie TT or Uncle JJ. This is when you go to Dr. Clark. This is when you go to Dr. Conyers. This is when you go to your gynecologist and have that conversation, right? Even as a woman who may be in the process of pregnancy or getting pregnant and wants to know the vaccine, because we're looking at the evidence. We're looking at the research that has been done. We're able to talk to you in a way that's not going to be you shaming, but to let you know all the information for you, then go out and make the informed decision. We know that the people who are getting COVID and the rate, again, of impact is affecting us as a population more so than any other population. And so for me, encouraging the vaccine to those 12 and up is important, encouraging a youth to even advocate for themselves, because some parents are against it, but the youth want it. And so how do you even begin to have that conversation with the youth to say, have a conversation with your parents, and this is how you have a conversation with your parents, because they really want it and believe in it as well. I think our youth are a voice as well for other youth and their peers to get the vaccine. When one has it, others may go and get it. They can talk about those things. And I think with the new Delta variant that's out, or the Delta variant and not possibly other variants that will come, this COVID vaccine is going to keep us safe as a community, as a population, as a people. And again, as Dr. Clark already mentioned too, we need to protect those who can't protect themselves right now. And those are those, well, under the age of 12 until we get some more research in a couple more months and the data comes out. So I just think that being mindful of who you are living with, who you can protect. If you don't want to get it, fine, but are you wearing your mask? Are you social distancing? Are you thinking about others? Are you just thinking about, you know, yourself? And then when it's time for you to make that informed decision, make sure your information is coming from reliable sources, credible sources, not social media. In this case, yes, social media, we're using Facebook Live. This is okay tonight, but just being mindful of who you're using and the sources, and talk to us. Our contact information will be shared. Reach out to us if you need someone to come speak to your organization. Common Ground Health has a speakers bureau. We can come and speak, show the evidence that's out there. That's it for me.
I ain't got nothing to say.
Yes, you do.
She put my organization up and everything. I'm like, I'm all done. I think she wrapped that with a bow. But no, I honestly, I do. I think she really did wrap it up. Listening to trusted sources is critical, but also being understanding of how you want to receive it. You know, we talked to some young people yesterday, and you know, one of them said, why would I go to the RTS bus terminal and get my shot? I get my shots at my doctor's office. Then get your shot at your doctor's office. That's okay. Some people need it one way, some people need it another way, and that's okay. And I think the other thing, as Dr. Conyers said, is we're not here to shame. The only people I do want to shame are the people who call themselves scientists who are misrepresenting science, because there are some of our colleagues out there who are unfortunately spreading some misinformation. But we do have several trusted sources like the CDC. Who doesn't trust Anthony Fauci? Anyways, and you know, we have our own local resources like Dr. Conyers mentioned, Common Ground Health, our Speakers Bureau, but we also have our Finger Lakes Vaccine Hub, flvaccinehub.org, that has everything from where to get tested to where to get vaccinated to answering your questions. And like Dr. Conyers also said, is when you're protecting yourself, the other thing you need to do is to think about getting tested frequently if you're not going to get vaccinated, because we have a lot of people out there, Typhoid Mary, think you're doing fine, and you get grandma sick because you feel well, but you got COVID. So it can be a sneaky disease, and it can look like lots of different things. So just, you know, keeping aware, talking about health literacy, this is part of it, you know, getting the information, knowing your sources of information. And when all else fails, the trusted relationship you have with your own doctor, nurse practitioner, PA, or provider, midwife, whomever, to have those conversations, somebody that you know understands the science, can debunk the myths, and can get you where you need to go. So I think, you know, and I don't know why they call that the Delta virus, y'all. I'm sorry. But Cap is on the way. We already burned through Alpha. So, you know, so anyways, we one thing that we need to understand is that's what viruses want to do. The only thing they live to do is to reproduce and spread. So when somebody's unvaccinated, they're the perfect host so that they can work their little machinations and be ready to be more efficient and more deadly. So I do really promote the vaccine, but I do understand people who are not ready to take it just yet. Thank you.
Thank you so much. Wow, what a great conversation tonight. So we have about 7 minutes left. I'm not sure if there have been any questions posed in the chat via Facebook, because I can only see my fabulous panelists. If someone could tell me if we have questions in the chat, that would be great. No questions? Again, on behalf of the Rochester Alumnae Chapter of Delta Sigma Theta Sorority Incorporated, we want to thank you all for participating in our 2021 Red Week celebration. This Wellness Wednesday conversation, again, it was very important. And in fact, it's probably a conversation that we need to somehow schedule again, because tonight you ladies gave out some incredible, powerful information, but the conversation must continue in order to keep all of us safe and healthy. So with that being said, thank you so much. If there are no more questions or comments, everyone who joined us, have a great night.
Thank you.
Thank you.